How do I understand my AFP blood test results for liver cancer? Imagine sitting in your doctor's office, waiting to hear what your blood test results mean. One of those tests might be measuring something called alpha-fetoprotein, or AFP. This protein is normally made during fetal development by the liver and yolk sac, but in adults, AFP levels are usually very low. When doctors order an AFP blood test, they're trying to see if there's any abnormal production of this protein, which can be a sign of liver cancer or other liver conditions. Most healthy adults have AFP levels between 0 and about 8 nanograms per milliliter. If your AFP level falls within this range, it generally suggests a low chance of liver cancer related to AFP. But it's important to remember that a normal AFP doesn't completely rule out liver cancer because some tumors don't produce much AFP at all. That's why doctors don't rely on AFP alone to diagnose liver cancer. They combine blood test results with imaging tests like ultrasound, CT scans, or MRIs to get a clearer picture. If your AFP levels are elevated, it can be a sign of liver cancer, especially if the levels are above 200 nanograms per milliliter. Levels over 400 nanograms per milliliter are considered highly suggestive of liver cancer, with a high likelihood that cancer is present. Very high levels, such as over 1,000 nanograms per milliliter, are rare but often indicate advanced disease. However, it's crucial to understand that elevated AFP isn't exclusive to cancer. Liver conditions like hepatitis, cirrhosis, or liver regeneration after injury can also cause AFP levels to rise. AFP can also be elevated in other types of cancer, such as testicular or ovarian cancers, and even in some lung cancers. During pregnancy, AFP levels naturally increase because fetal AFP crosses into the mother's blood. To help distinguish liver cancer from benign conditions, doctors sometimes measure the AFP L3 fraction, a subtype of AFP produced specifically by malignant liver cells. If the AFP L3 percentage is above 10 to 15%, it suggests a higher risk of liver cancer and may indicate a more aggressive disease. Your healthcare provider will interpret your AFP results in the context of your overall health, risk factors, and imaging findings. For people at high risk, such as those with chronic hepatitis or cirrhosis, screening every 6 months with ultrasound and AFP measurement is recommended to catch any early signs of cancer. If you already have liver cancer, AFP levels are useful for monitoring how well treatment is working. A decreasing AFP level often means the treatment is effective, while rising levels could suggest the cancer is progressing or coming back. It's important to remember that AFP testing has limitations. Not all liver cancers produce AFP, and some benign liver diseases can cause elevated levels. That's why your doctor will never rely solely on AFP results to make a diagnosis. They will consider your symptoms, imaging tests, and possibly a biopsy to confirm the presence of cancer. In summary, understanding your AFP blood test results involves looking at the actual AFP level, considering your personal health history, and combining this information with other diagnostic tools. Elevated AFP levels, especially above 200 or 400 nanograms per milliliter, can raise suspicion for liver cancer but are not definitive on their own. Always discuss your results thoroughly with your healthcare provider, who can interpret them in your specific context and guide you on the next steps. Remember, each person's situation is unique, and medical decisions should always be personalized and made in consultation with qualified professionals.